Hi, this is my third blog. This is day 2 of my breast augmentation. I got them done yesterday morning. I had to be at the hospital at St. Vincent's Hospital in Carmel at 6:30 in the morning to prep me for my 8:30 surgery. Everything looked good. I went from a B to a D. I'm swelled quite a bit right now, and you can tell they're kind of high. I've been trying to do a little bit of exercises. He didn't really talk too much about them right now, but I find out if I kind of do some and hold them together and things, it kind of feels good. I'm on, they gave me Zephyrdroxil. I'm not sure how you say that, but it's an antibiotic. He gave me 2 days worth. I take 2 a day. The night before, I had to take Valium, which helped me wonders because of my nerves. It helped me sleep. I took another Valium before I went into the hospital. The other is hydrocodone. I'm taking, it's like probably a generic form of oxycodone. I'm not sure, but it does wonders. I started taking 2 at first. Now I've kind of weaned myself down to taking 1 with ibuprofen with it. You do want to stay on every 4 hours like it suggests. I overslept 1 hour for a nap, and I woke up in an excruciating pain. I was able to take a bath today. The very next day the doctor said I could. I've seen some YouTube videos where they don't want them to get their sutures wet, but he said a clean suture is a happy suture. It'll heal faster. I did go bilateral. I went underneath here. I know you can't hardly see them, but they're down right underneath there. They're only about this big. I did the saline. I got a 510 cc on my left, which is more sore, and I got a 465 on my right. When I woke up, I did have a band. I didn't have a surgical bra. As you can tell, they're still kind of high up. I took a shower, which has made me feel amazingly better. I'll try to stand up, but you really can't see. But yeah, they're still swollen pretty bad. I feel good though. Do take them every 4 hours like they suggest. It does wonders for the pain. I kind of think I have a pretty good pain tolerance, but this hurt. I got out of the shower. The shower felt great to take, but my fiance was helping me. Of course, I couldn't have done it without help. Just bending over alone to kind of put a towel on my head and do that a little bit. Gravity was not my friend. It was pulling him down, and it really hurt. It didn't really hurt. It hurt. It was very uncomfortable. I've been sleeping elevated. I've actually been sleeping pretty good, but I think it's because of the medicine. I've got 2 pillows, 2 through pillows behind my back, and I'm staying inclined. I cannot pull myself up. He's having to kind of pull me with my legs a little bit and support me up with my back. It's unbelievable how much you use your pectoral muscles and you don't even realize it until you've gotten something like this done. I'm kind of starting to be able to raise my arms a little more. I'm trying to move around, keep the circulation going. If I'm laying on the couch, I do move my legs around. I try to move my arms and just keep my blood flowing, you know. I'm going to try to go for a walk tomorrow just to get some good fresh air. I did go out with a strap, no surgical bra. Victoria's Secret, I was going to get, a sports bra there. Those were like almost $60, so I thought on our way home, I was like, let's go ahead and try to go into Penny's if you don't care. I had seen them like $35, $40. Well, thank God for clearance racks. I went there and I got 2 of these for $12.99. They're perfect. It fits amazing. It's given just the right support and pressure that it needs to be comfortable. $12.99. So I got 2 sport bras for half the price of the one bra I would have got at Victoria's Secret, which I think is amazing. I got a medium and I got a large. Right now, because I'm swelled so much, I am doing the large. It is actually more comfortable. Kind of has the downward slope look still. It's not quite got the fullness. I did go high profile. I'm sorry if I'm jumping around. I'm just trying to remember things. I went the high profile. I don't have much feeling right now in my nipples, even though I did go underneath the arms. I kind of didn't think it would affect that very much. But I don't really feel too much. But then again, when I was in the shower, they were kind of sensitive. Almost, I don't know, it wasn't a pain, but I don't know, just like a raw feeling. If you just sit there and rub something for a while and you want it to stop, you know, that raw feeling, that's kind of how it felt. Other than that, I have to say I think I did really well. I give it for the hospital. The hospital was wonderful. It's the best hospital I've ever been into. The staff and the doctors, I couldn't have asked for a better crew. They were absolutely amazing. When they first took me back, they talked to me. They laid me on a bed, got me comfortable. I got dressed, everything except for my underwear. They put these wraps around your legs. It's kind of like for circulation, for blood clots and things like that. So it's almost like a blood pressure cuff. So it was going on and off on my legs, which actually felt really good. And then they had this vacuum at the end and put this thing over me and hooked it. And this blanket over me just kind of poofed up, and it was nice and warm. So I felt really good. One purpose of that is because the rooms that you go in for surgery are so cold. This keeps you warm. When they took me back there, they were very friendly. I guess because of the Valium I took the night before and one in the morning, I really wasn't able hardly to walk. I didn't think I was going to walk into the hospital because my legs just felt like rubber, but in the same sense my arms and everything felt like they weighed a ton. But when I got in there, I do remember them saying that she's not going to be able to move from this bed to the next, so they kind of bumped me up, and the nurse was at the foot, Dr. Akers was over here, and I guess it was the anesthesiologist was at my head. So they all three kind of moved me over. Someone behind me put a mask and just let me know that they were putting the oxygen over for me to take a few breaths. And I did that and remember nothing. I was out instantly. The next thing I remember is being in the room that I first started out with, just laying there. I'm not sure how long I came to. I think my fiance said I was back there about 45 minutes before they told him to come out. So I did get some good rest. Like I said, I did feel nausea on the way home, so I took one of those pills and it worked immediately. I took one of the antibiotics earlier today, but I did not eat anything. And within 2 minutes, I barely made it to, I hate to say it, the sink. I had nowhere else that was close enough, but I did get sick. I've taken my second pill. I made sure I ate something and I was just fine. My throat was kind of sore yesterday. My mouth, it's better today, but I really had dry cotton mouth. My lips were dry. I was taking a wet rag. My fiance was trying to wet my lips. I've had chapstick. I took off my sutures today after my shower. They actually look pretty good, so I'm not going to put anything on them today. But I did buy my Derma scar cream for when they start to scar over, heal up. I'm going to start putting that on there. I got Shea Butter stretch mark cream. I didn't see any stretch marks made from the breast implants, but I got it just in case. I noticed my nipples were maybe like a little dry, not too bad. Sorry, I keep messing with my hair, I know. Just got out of the shower and just keeps falling in my face. So I did put some there, and it felt good. But I'm pretty swollen. I know it's high up here. I'm already trying to do some of the massage where they tell you to go like this for like 15 seconds. Then I watched this one video where she was just kind of walking down her breast like this, and there was one where she was cupping it like this, and she was underneath, and she was just, that actually, if it makes sense, hurts and feels good at the same time, right underneath there, and that's not even where my suture is, my cut, but it's really sore. I'm swollen, my belly is bloated, my feet and my legs are, I can't hardly see my ankle bones, my face is poofy, but other than that, I think I prepared myself for a lot of, I don't know, negative. I guess it's easy to think of the negative things that can happen to you when you don't really know what you're getting into. But my whole overall experience, honestly, my pain at the most, besides that nap where I accidentally napped too long, that was probably felt like maybe a 7 or an 8. Other than that, I think I've pretty much stayed like around a 5. I've been pretty comfortable, but like I said, it's the medication. Take the medication like you're supposed to, and it will do wonders for you. I plan on doing another vlog tomorrow, and then I'm going to do like 1 week, I'll do 2 weeks, I'll do a month, 2 months, 6 months, and maybe a year. But if you guys have any questions whatsoever, feel free to ask them at the bottom, and I'll answer them the best that I can. The reason I'm doing this is I watched these YouTube videos before I got this done, and when I first went my orientation with the doctor, I thought I knew what I wanted. I watched a lot of these blogs from different girls, and it actually educated me quite a bit. And by the time I got in there, it was nothing of what I initially went in there in the first place saying that I wanted. And I'm very happy with my results. And I'm just hoping for anyone that's thinking about getting it done or already has their appointments going to get it done, that these blogs kind of help you as much as they helped me. That's kind of what my intention is for these. I guess that's all I have to say today. It's after 1 in the morning. Like I said, I almost missed my day 2 blog. And I will do another one tomorrow. Okay, good night.